Well, finally we seem to have the summer arriving, but Parliament is now in recess and I just wanted to update you about the NHS. All of us cherish the NHS. It is something which is really a much beloved national institution, but it is beset by many problems despite the huge sums of money which have gone into the NHS in the last 10 years. And what I wanted to do today is just provide the opportunity to update the situation in Suffolk in particular and also refer to the national situation as well. The situation in Suffolk from a budgetary point of view is still very bad. For example, West Suffolk Hospital in Bury St Edmunds wanted to seek foundation status. This would have given them the opportunity to have a much more flexible budgetary arrangement. Unfortunately, because of the historic debts attached to this hospital, they have been unsuccessful in moving this process forward. A huge disappointment, particularly to the wonderful caring staff and professionals at the hospital. And that is just one sign of the difficulties. If you go to Haverhill, which is the biggest town in my constituency, which is also the fastest growing town in Suffolk, incredibly, the GPs in the town have just been told that they are to lose over £300,000 from their budget. Now, there is some formula which is meant to deal with this, but I have to tell you I'm very suspicious of these particular formulae. How can it possibly be right that in this town, where there are still some quite significant health problems, and which is expanding so rapidly, that there could be cuts of this sort, which will undoubtedly impair the provision of primary care services? And the reason why I'm rather suspicious is we know that this health formula has ruthlessly discriminated against people in Suffolk and West Suffolk in particular, where we get funding well below the national average. And all the indicators, for example, the number of beds per capita at any level, are well below the national average as well. And of course we're all paying a price for this. I also wanted, very importantly, to update you about Newmarket Hospital. Now, we've all been fighting to make sure that there is a provision of in-house beds in the hospital, that the integrity of the hospital is preserved as a wonderful asset to the local community. After all, this hospital is only 10 years old. What is encouraging is the fact that I've been talking to the GPs in the town. They in turn have been talking to the Primary Care Trust about the possibility of establishing a facility to provide new additional services on the hospital site. And that is exactly what the hospital is there to do, to provide important services to the local community that are of value. Now, in many discussions I had with the previous Health Secretary, Patricia Hewitt, it seemed to me we were well on our way to getting this resolved. Immediately that the new Health Secretary was appointed, Alan Johnson, I wrote to him and said, now come along, Secretary of State, let's get on with it. There's no reason why now that this should not be supported. The Primary Care Trust supports it, the local community, the local councils, GPs, everybody wants this matter resolved. And very regrettably, he wrote back to me and said that he was referring this matter to the Independent Reconfiguration Panel. You couldn't make it up, could you? But unfortunately, in the bureaucratic nightmare that exists for the NHS, we are having a further review, can you believe it, of the way the NHS operates. After 10 years, yet another review by this government. Now, he therefore has referred this matter to this particular panel, and it will report towards the end of October. But I really don't think this is good enough. So today I'm writing to him saying, look, come down to Newmarket, see for yourself what a proper community hospital can be like. Everything is there that is desirable in terms of what the government wants. Please do not delay this decision anymore. And that is something I am very pledged to do with the other health campaigners in the town. And finally, I would simply like to say this. With all this money that has gone into the health service, and undoubted improvements in clinical care in many ways, with improvements in medical and scientific discoveries, it is truly shocking that the level of deaths from bugs in our hospitals has actually trebled in the last 10 years. our hospitals have one of the worst records anywhere in Europe. And it is really dreadful that people go into hospital unwillingly in many instances, or in fear of getting some sort of bug that will either damage their health or, I'm afraid to put it bluntly, kill them. And this is happening all too often. Here we are in the 21st century, one of the richest countries in the world, where our health service is being stretched. We still have significant cuts and deficits going on, but tragically and importantly, in hospitals, people feel worried about going into them because of these bugs. Now, I don't want to be pessimistic. There is wonderful work done in the health service. We have some of the best nurses, doctors, ancillary workers anywhere in the country. We're very proud of them. I salute them. But somehow, I don't think that the system that is in place is working to their advantage fully, or that of the patients in my constituency.